At the University of Buffalo, my lab is in the Cannon Stroke and Vascular Research Center. And there, my lab focuses on studying neurovascular disease like brain aneurysms, strokes, AVMs, and now even brain tumors. We were finishing a couple of studies that were funded by the Brain Aneurysm Foundation. We eventually, got the idea to create something that we could commercialize as a test for a brain aneurysm. And so that's when we created a spin-off company called Neurovascular Diagnostics. And broadly, its goal was to develop diagnostic and prognostic tests for neurovascular diseases, starting with brain aneurysm.
Our goal is to help a lot of patients, so the main point of our test is to screen patients that may not be screened otherwise. So they may have family history, but don't qualify to get imaging, so be able to screen a lot more people with just a simple blood test. And additionally, we're trying to add in risk so they could then know how risky that aneurysm is.
Screening by using medical imaging in a widespread fashion is not cost effective. And so what we want to do is introduce what's called essentially a pre-screen into the clinical space where the doctors can first pre-screen your blood and then identify if you're a good candidate for follow-up diagnostic imaging.
My grandmother actually passed away from a ruptured aneurysm, so the work is very personal to me, and I understand how significant it can be for people that are dealing with that and the repercussions of aneurysm rupture. One of the big problems is that they're largely asymptomatic, so I think one of the biggest things we need to focus on in the next few years is getting them screened ahead of time and being able to identify these aneurysms before they rupture.
It really kind of gives a meaning behind the research, and especially through work that I've done with the Brain Aneurysm Foundation and talking to people who have experienced a rupture themselves, that really puts this type of work into perspective and gives a lot of meaning behind it. The Brain Aneurysm Foundation has funded a lot of my research work pretty much through my whole entire career.
The work that they do is so inspiring, and I've met Christine and other members, and just to see their passion is really, really incredible. We wouldn't have been able to get these larger grants without the initial seed funding from the BAF.
Our broader vision of this diagnostic is to provide the clinicians with a tool that can help catch aneurysms early and also help them predict which ones would rupture. But I think it will also provide patients with better peace of mind and more knowledge about what is going on with their health.